This week on the BackTable podcast.
What I would love to see more of is physicians partnering with industry to help develop the next generation of tools. Instead of shying away from business and industry, I think we really need to jump in, because if we can collaborate with these partners, the wave of technology that we could usher in, because we're really getting buy-in from physicians nationally about how to improve on devices and what we really need from the thousands of people that are using it on a day-to-day basis, I get excited about that aspect of medicine. And it's one of the reasons why I went into vascular, and I'm sure it's one of the reasons why you went into IR, is that I feel like we are at the forefront of this medical technology revolution that's happening, and it's not going anywhere. And we should continue to champion that, because I think it's meaning better outcomes for patients at the end.
Hello, everyone, and welcome to the BackTable podcast, your source for all things interventional and endovascular. You can find all previous episodes of our podcast on iTunes, Spotify, and on BackTable.com. Hello, everyone. Welcome to the BackTable podcast. Today, we've got another great episode lined up. We're going to be talking about physician-industry relationships. I've got special guest, vascular surgeon, Dr. Adam Tanious. Adam, welcome.
Hey, thanks very much for having me.
Adam and I connected via, I think, LinkedIn, right? Is it LinkedIn? Yeah. And then I got to listen to your TED Talk, which was awesome. And so we'll definitely put a link to that in the show notes. Remind me, what was the title of the TED Talk, in case anybody wants to just quickly search it?
Yeah, the title of the TED Talk was Big Business and Surgery, Who Belongs in Your Operating Room?
Right, perfect. And granted, it's 10-ish minutes, so not terribly long.
Yeah, about 10 minutes.
But you covered pretty succinctly, but, I think there's a lot of room to expand on this topic. And so, you and I connected. We said this would be a great podcast, and here we are.
Yeah. I mean, the TED Talk went from about 20 minutes down to 10 minutes, and 20 minutes I was still having trouble getting it down to 20 minutes. So I think it's a huge topic, and I think people are recognizing that, especially, and I think it was really fun when we reached out and you were sort of, I guess, really jazzed about the concept, because it's so prevalent. So it's exciting to see that people are wanting to talk about it more.
It's prevalent across all, definitely surgical subspecialties, right? Even in medicine with pharma, right? There's, it's the same concept, really. It's really, any doctors face this. My wife and I talk about it fairly often, because she was in academics, you're in academics, and it's even a little bit more kind of like, I don't want to say like frowned upon or just kind of stringent in the academic setting than it is in private practice, I would say.
Yeah, it's, any interventional specialty, I think it's becoming, it's something you have to see, right? And it starts back when you're a med student and you're like looking at your first lectures and you see your mentor's slides and they have these disclosure slides. And you're like, disclosure? What does that mean? And then you see the names of companies and you're like, why are there companies on their disclosure slides when they're talking about the surgery? And then you kind of get into the world and, it unravels from there, right? I think most people, I guess, in our generation who went into medicine can remember when they were first shadowing a doctor and the pharma reps would bring a lunch to the office or something like that, right? And I think we've gone a long way from there. But, I think there's no doubt that business and medicine it's a relationship that's not going anywhere. I think we just have to really figure out where that relationship is heading.
Absolutely. Like how to make it healthy, basically, right?
Yes, absolutely.
It's got to be, it has to exist. Like we need the tools, they need the input, and they need to be able to help us with these tools. It's just, how do we make this a healthy relationship and not a dysfunctional relationship, which we see oftentimes, right? That's really kind of like what I wanted to get into the meat of. But first, let's take a step back. Let's tell the audience, where you're at, what your practice looks like.
Yeah, absolutely. So I'm in my first job out of training. So finished training 2021 in Boston, and came down to Medical University of South Carolina in Charleston, as an assistant professor of vascular surgery. Started with some educational things and innovation, sort of championing innovation and education. Recently, I've taken on a lot of dialysis access and trying to also increase the presence of sort of pediatric vascular surgery, and then partnering with a lot of my surgical oncologists to provide vascular surgery care to the surgical oncology field. And so a few different clinical interests, but really my main non-clinical interest has become innovation. And then part and parcel with innovation is relationship with industry and sort of the the big drivers of innovation in medicine over the last decade, I would say.
Fantastic. Thank you for that. And you also did the Quantic MBA, which I have to take my accounting exam this week. I'm really dreading.
It's the worst one.
Yeah,
so
I know.
Once you pass that one,
at least get it out of the way, right?
Get it out of the way. Yeah.
But thank you again for your feedback on that. We've covered MBAs for physicians topic in the past, and now that I'm in it, I just see the value of it. And, not to get off on a tangent, but I kind of want to throw that out there that you were also very helpful in guiding me on kind of like, the Quantic program. I've heard, Vino Vadalamuni's gone through the Quantic program. Raj Kalza, a couple of those guys have been on the show as well. And everybody kind of, says it's done well for them. So appreciate the insight on that.
Of course. And I'm just, it's kind of fun to talk to people who are recognizing that I think we as physicians, we need to learn that language, right? I mean, essentially, I've watched your podcast on the MBA thing. I struggled with this. In fact, one of the biggest fights I had with my wife was about getting this MBA. I wouldn't change anything at this point. I'm really glad I did it. One of my partners did it before me. And again, I think when you look at the way hospitals are being run and you look at the system that we're being put in as physicians and as interventionalists, the people running the show speak a different language than we do as physicians, right? We spend 4 years of medical school, X number of years in training, learning our craft, learning our language. And then you start to realize how you're compensated, how things run, and people are speaking a totally different language. And it's just like anybody who's traveling in a foreign country and wants to see and talk to the other people there when you can't, it's frustrating. I think that was my biggest driver. And I think it's just been a great resource kind of moving forward. And then particularly about this sort of big business and surgery and understanding how medicine and business interact, I think you can't start there without having the foundational knowledge of what is business, right?
Absolutely. And I think, and that's one of the main drivers for me too, other than just like helping with, my business knowledge for BackTable, is speaking that language. I mean, it is another language. It's just kind of like, I was talking to my partner about this. It's like, he's like, I'm learning the language of medicine and sort of how to talk to the docs about these topics. And I'm like, I'm doing the same thing with business. Like there's COGS and, there's all these terms that like you don't use in medicine. You don't learn anything about that. It would be great to, even if she had like a 101 in med school on business of healthcare, it'd be amazing.
And I mean, I don't know if you have any friends that are dentists, but I grew up with a few friends that went into the dental school path, and they actually get some education in dental school about how to run a practice, right? Because a lot of dentists go into sort of individual practice, and they just recognize very quickly, like you have to know the business side of what you're doing, because we operate in a medical field where it's not socialist medicine, right? So you have to understand what the business principles are of going into the field you're going into. And I respected that. And I think that I will be quite frank, one of my next projects is actually trying to bring at least an elective, if not some part of business curriculum, to the medical school here. That's my next endeavor. And I'm partnering with one of my interventional cardiologists here about doing that, because I just think we've got to start somewhere.
That could be a great product for Quantic, actually. If you created like a business 101 for docs, you should pitch that to them.
Listen, if hashtag Quantic, if you're listening.
There you go. We little free promo.
Yeah.
Well, let's get into the meat of the topic, which obviously getting your MBA, I think, is part of this. Again, in terms of like speaking the language, especially when you're talking about big business, you mentioned, at the administrative level at hospitals, but also on the industry side, whether it be med tech or pharma, we do interact, not only with our sales reps, but at conferences we're a lot of times interacting with the marketing folks, with even CEOs of some of these companies. And it is good to be able to speak their language, because a lot of times they know how to speak our language, right? They oftentimes came from medicine. They were former techs, nurses, and stuff like that. And they went off into these businesses. I heard you give this TED Talk, and the first thing that came to my mind was, how did this come about? How did you get interested in this topic? And then how did you actually like get to do the TED Talk?
Yeah, absolutely. And so it came about really because of my relationship with my wife, who, for anybody who's heard it, no spoilers, but my wife is a medical ethicist. So she's a pediatric anesthesiologist who specializes in ethics, and did an ethics fellowship when we were in Boston. And I actually am the son of, I think, one of the greatest salesmen to ever be in the world of finance. And so it was this marriage of my family history of being involved in sales, going into medicine and seeing that sales was involved and thinking this is absolutely normal. This is the way of the world. Absolutely. There should be dinners where people are talking to me about the products, and I should order the biggest steak I can and enjoy that wine I'd never buy for myself, when I'm at those dinners. And then it was my wife asking me point blank, like, so they buy you all those things, but then they're in the operating room with you the next day and helping you make decisions that affect patients' care and the life of a patient. And I basically told her, and again, one of our bigger fights was like, stay in your lane, lady. You don't get it. You don't understand. You're not an interventionalist. You don't understand, or you're not in sales. So you really don't get how the world works. And I was a trainee at the time. And then it really hit me when I became an attending, because I'm sure you probably had this same exact situation, right? The relationship dynamic with industry and big business when it comes to interventional specialties totally changes when you go from the learner to the decision maker in the operating room, right? And that transition hit me pretty hard. And I'm pretty lucky. I have some really wonderful relationships with my reps here in Charleston, but it's still, you just really see the idea that there's sales involved, right? And so this concept of sales mixing with patient care and then having, spending every night with an ethicist, right? That really just sort of, I guess it jarred me, and it got interesting. I actually wrote an editorial about it in the Vascular Specialist, which is just a really fantastic sort of periodical put out in the world of vascular surgery. And then we had a couple of surgeons here at MUSC that gave TED Talks the year before me. And when calls came out for TEDx Charleston, I said, you know what? This is something we need to talk about. And I love the idea that the TED platform is an international platform, even if you're doing a local TEDx, which is an independently sponsored event locally. But I still think that it's an amazing platform to get a message out and start a conversation. And so I applied and went through about 4 or 5 rounds of interviews, and then got accepted, and then had about 4 months of coaching. And, it's really funny to look at what my talk looked like on day one to what it looked like on the stage. I really came away with some really wonderful education about how to be a public speaker, which was amazing. And it helped me really craft the idea. So yeah, it was just a fantastic process.
That's so interesting that they, it makes sense, because they want you to know what you're doing when you get up on stage and not fumble about, because you did sound and look very polished in how you gave that talk. It's really neat to see our peers on there, like you said, because they are very influential, and it's not just it's not like BackTable where it's just mostly docs listening. There's like a layperson crowd, and TED obviously, and then they put that on YouTube and all their distribution channels. So did you get any idea of how many people have listened to it?
It's a game to me in the sense of how many views did you get? Are you where you at?
Yeah,
I kind of fell into that a little bit.
Right.
I think, the count last time I checked was somewhere around 2,000, which, is really awesome. I never expected that many people to listen to anything I've ever said. Right. So it's great. But, I think it's the cool thing about it is this idea that the hardest part about the talk was actually bringing it down to the level of non-medical people, which is what I love about the concept of the TED, programming, is that you really want it to be a generalizable message. So I had to work to really make my message have people who are non-medical, who would be patients in this example, or the loved ones of patients, understand why this matters and what's going on and where they play a role in this dynamic, because they do play a role. And I think that, again, just like every one of my colleagues and every one of our professionals in medicine, I think craving more knowledge about what we do in the world of medicine, especially as our population ages. And, even though people like my parents may not be so interested in their own health, as their child, I am extremely interested in their health, right? And so you have this sort of really engaged audience now that is just trying to understand as much as they can about the world of medicine. And I think it's a wonderful thing that a lot of docs are doing to try and bring that knowledge gap down so that people can really be interacting with us and be partners in their own healthcare. And so that was really one of the main messages to to the lay public when I was giving, this TED Talk, was trying to help them understand where they fit into this equation, realizing that they're the main part of the equation, and then what they can do to really champion for themselves.
Yeah. And let's talk about the free cup of coffee that you mentioned in the talk, what that means, how it becomes like a slippery slope towards influencing patient care.
Yeah, the cup of coffee. I mean, I'll be honest with you. It was my dad, right? I mean, it was very much, I learned from him really early on. If you want to get your foot in the door, if you want to just meet somebody or get someone to, like, how do you say no to a cup of coffee, right? And especially in medicine, right? I mean, if it wasn't for espresso shots with some form of milk in them, I don't know if I'd be getting through the days the way I do, right? And so as a trainee, it was so easy to say yes to a cup of coffee from a rep who, obviously had the trust of your mentor because they were in the case with your mentor and you were there. And then, this cup of coffee is offered to you that you weren't going to go buy yourself a Starbucks on a resident's salary, right? I mean, you were going to go make your whatever drip Keurig, coffee that was at home. But this idea of having a lovely Starbucks or whatever fancy latte bought for you, and then talking to somebody who's a little bit outside the world of medicine, but inside the world of medicine to give you a little bit more fresh perspective, and then talk to you about all the fun things that industry gets to talk about because they have the resources to talk about it. It's a very alluring prospect. And I think that it is it's just the concept of that cup of coffee, I think, is just one to really capture the idea that you have to realize that the industry side, the big business side of things, they have an objective now. And you said this, I think, beautifully earlier when we were talking, is that this relationship can really be symbiotic, right? I mean, the concept should be that industry wants to create products that absolutely, without question, help make the lives of our patients better and make our job as interventionalists easier so we can get patients through really complex pathologies. And so when industry creates amazing products and the patients want minimally invasive options for surgery and that mix happens, it's a match made in heaven, right? But at the end of the day, industry answers to being a profitable company, right? I mean, they're not, none of the companies we're talking about are non-for-profit companies. They're all for-profit companies. Now, whether they're privately held companies or publicly traded companies, they're still for-profit companies. And so, again, being a student of business as you are, is that for-profit companies answer to a very different bottom line than a physician taking care of a patient. And so when you say yes to this cup of coffee, I think we just need to unpack, especially to our trainees, so that they get it as they're coming through, what you're saying yes to and what is behind that cup of coffee. Sorry, long-winded, but it's so fascinating to me.
Absolutely. And so, like, what are, we kind of touched a little bit about it, but what are the potential risks and benefits of that relationship, specifically physician to having that sales rep in the room during surgeries? You put this very succinctly and eloquently during the TED Talk, but kind of want to delve into a little bit further too.
Yeah, absolutely. And so let's start with the benefits, right? Because I think that, and I was very clear about this in my talk, is that I am in no way trying to villainize industry in my message, right? And in fact, I think we need to be partners with industry. And for everybody who is non-interventional to understand, when sales reps or device specialists are in the operating room with us, their job is they get on the job training about the devices that they represent for a certain amount of time. We're talking up to 3 months of time. They're learning, they're studying, they're talking to the engineers of the company, the people who build and make this device, understand it from top to bottom, inside out. And then their job is to go around their territory and watch this device be implanted hundreds of times a week all around by different level experts in the field. So by the time they get to your operating room, they have seen their device used without question more than you've seen it used, because as the individual interventionalist, you are being asked to do so many different types of procedures. The chance that you're using one device all the time, every day, every week, is impossible in the world of medicine that we live in, right? Especially in the United States. And so to think that we have all of the knowledge about a product, I think is hubris on our part. And so to have somebody in the operating room that is a true expert in that product, who understands the ins and outs of it, is just an invaluable resource to have, especially as a young attending who's trying to figure out their way in the world and orchestrate the chaos that is an operating room, right? And so the benefit is just having somebody else's brain who knows that product in and out so that we can use our brain to do the other complex parts of the surgery, which is orchestrate our anesthesia colleagues and how the vitals of the patient are, the surgical techs to make sure everything else that we need in the room is correct. And so it allows you to sort of parcel out your brain so that when it comes to the device part, if something else is going absolutely crazy, you know that somebody's there that knows that device in and out. So if something doesn't go exactly perfectly correct, you have somebody to be like, hey, I haven't seen that happen before. What's my next step? What are my options? I know that the IFU packet says this, but you've seen this used in real life. How do we get out of a bad situation? And my best example is I've been in a couple bad situations. One, the one I mentioned in my TED Talk, where if it wasn't for a rep, and a device having deployed inappropriately and them having seen that happen and then telling me how to troubleshoot it, I don't think I would have gotten the patient off the table. And so the benefits are real. And I know that, we've talked about this. You've clearly had similar experiences in the operating room yourself.
Absolutely. Yeah. I mean, there's been times, look, you're absolutely right. And we did an episode on what makes a good sales rep. And honestly, it's their expertise and experience. Where I see the danger is you have a green sales rep with a green attending. That is not good, right? And that's where I wish kind of industry would be a little bit better at matching that, and that was kind of my frustration when I was fresh out, 1-2 years out, where I would be, for example, doing a kyphoplasty and using a new product, and they would send me the rep that just joined, 2 months ago. And I was like, this isn't going to work. And those kinds of experiences are actually part of the reason why I started BackTable, because then I found myself on the phone with a colleague, right? And I was just trying to crowdsource information from colleagues. And then, over time, I got to know the reps in my area, those who were good, those who were bad. And when you get a good one, it's incredible. It's like having a colleague in the room. And like you said, they bring those years of experience, all that troubleshooting that's happened. And yes, they've gotten me out of, many of the sticky situations where it's like, okay, anybody have any ideas? Boom, they've got one and it works, right? And so they are very useful. It's just, that's the whole thing is okay, how can we avoid conflicts of interest where you get somebody who's maybe not either, they don't have the experience or they're just driven by profits, right? Where have you seen that sort of unfold and how can we improve those things?
Yeah, no, it's literally, it's the beautiful example you give, because the concept is that, and this is exactly what happened to me. It was, I think in our day and age, the amount of medical technology that are trying to tackle different parts of disease that is new and exciting and we want to get our hands on is just, it's presented to us at a rate that no other generation of physician has had to be exposed to, right? I mean, people who practice medicine 10, 15 years ago were not having a new tool or new technology presented to them on an every quarterly basis to treat something in their wheelhouse the way we are, right? And so exactly the situation that happened to you has happened to me, where I had a new rep helping me with a new device because I wanted to be able to offer patients as, at a tertiary quaternary care center, I wanted to be able to offer a specific type of procedure because people are asking about it and sort of want it. And for the right patient, it does make sense. And so you have a new product that I have only used in vitro, right? I mean, in sort of practice models, and that's just the way of the world, right? I can't practice on a human being, but I practice as much as I can in vitro. And then a patient wants the procedure. I have watched it, I've studied it and what have you. And then I have a green rep with me as I'm trying to do this procedure, and it doesn't go perfectly, right? I don't get the result that all the YouTube videos and the Instagram videos and the LinkedIn videos show when people are using the device. And again, there was troubleshooting that I probably needed but didn't get because I didn't realize, I was junior as an attending at the time, that I should have said, absolutely not. I need somebody who has seen this device used 1,000 times in the operating with me if you want me to be trying to use this device, right? Because I think we have to understand as physicians that, again, the reps, now the great reps are the reps who will literally grab other companies' products off the shelf because they know it's what's going to help the patient on the operating room table at that time, right? That's a mark for me of experience. It's a mark of humility, and it's a mark of championing patient safety and patient care overall. And, those are the reps who I literally I mean, I call them by, we call each other by our first names. We talk about our families, and I will happily have dinner with them and buy them a cup of coffee because that relationship to me is invaluable, right?
Yeah.
But it's the situation where you are dealing with people who haven't gotten to that point yet, right? Or again, you have to also remember, like I answer to a chief of vascular surgery who has specific things for me. Sales reps answer to territory managers who are trying to understand why numbers are either up or down and are trying to help them increase the sales of their product in their area. That's sales, right? There is no, we can split hairs any way you want, but sales is sales, and territories are supposed to grow, right? And numbers are supposed to increase, right? Because that's how things go in the world of business. And so you just have to know that is on the back end of what's going on of the industry side of things. And again, there are the people who manage that very well, and then the people who don't. And so I think the risks are realizing that sometimes you really do have to be a good judge of character and understand who's in the operating room with you and what their primary motivators are, right? And and again, I think that comes from, first and foremost, it has to come from senior attendings, people who have been in this for a while, helping the trainees recognize that kind of thing, right? So like, how come nobody as an attending told me before I graduated, like, listen, when you're starting out and you're doing things, you better have an experienced rep in the room if you're using a product you haven't known or used before. Like, that was not a piece of advice that anybody gave me, right? They would always say, like, yeah, have your reps in the room, that was it. There was no qualifiers. There was no, and again, it's that I think there's nuanced education to this that we need to be giving our trainees, so that it's the physicians that are ultimately the captain of the ship and driving this relationship, and we need to be understanding the important nuances of it. Sorry, again, long-winded, but it's that.
No, but what you said at the end there is a great segue to my next question, which was, and just like a little bit of background on this, when I was in fellowship, sales reps were not allowed into the department at all. And even the one rep that I got to know one rep, and we had to sneak around the section chief because he didn't want to hear about it. He didn't want to know that we were talking to anybody. And, I got taken out to one dinner during all of fellowship, and I was like, this is great. This guy's amazing. He's teaching us stuff. I was like, why are we not allowed to do this? You know what I mean? Like, I didn't quite get it because I was being taught just how to use certain devices and what was on the shelf at that place, right? And then when I get out in practice, I'm going to all these different hospitals, they'll have different, devices. I'm getting these reps to come out, but I don't even know how to interact with them. I don't know what their role is. Like, okay, are you supposed to be teaching me how to use this? Are you just bringing the product and dropping it off? Like, I kind of had everything happen to me, and it took me like a good solid year or two to kind of figure out like what that relationship is supposed to be like. Right.
Yeah.
But it was very much hit or miss.
Yeah.
And so it kind of touches on what you said at the end there is we should be training or teaching the trainees how to interact with industry.
Yeah.
It shouldn't just be this black or white, like you're not allowed in, don't talk to those guys. They're evil. Cause that was kind of like what they were trying to impress upon us, which is, bullshit. You have to be able to. That's how innovation happens.
Right.
Right. So I wanted to kind of get your insight on that piece of it, because that was my experience.
Yeah, no, it's funny how we're different, but we're the same, right? I mean, we've all gone through a lot of the same stuff. And I remember my first hospital that I trained at, it was the reps who taught me a lot about my field, because it was a really busy hospital where we were doing a lot of crazy stuff because we were the big hospital and like for 120 miles, and it was the reps who were in there giving me guidance while, am I allowed to say that people were running 2 rooms and stuff like that? And I was,
right.
Just being honest, right? I mean, that was what was happening. And the other thing that I think is really important to mention here is that most every like big business industry company has a whole section dedicated to education of trainees, right? There's literally factions or divisions within each of those companies that are filled with some of the most amazing people who are just trying to get the trainees educated about their product. Now, again, you have to understand the backside of that, right? Because if you are getting wonderful education about a product and you feel like you're being shepherded and ushered and welcomed in a very nurturing way about using a product, when you get out into the real world and you have to choose a product in a moment of like, insanity of an OR case and, poops hitting the fan and you have to use a device and then like, you're like, what's the device you're going to remember where you had that wonderful educational opportunity? Like, yeah, but again, that's sales. And so but is it bad? Absolutely not. It's wonderful to have that ability that industry has to have these resources to provide cadaver labs to use their technology so that, you really aren't doing something in vitro, but you're really doing it, quote unquote, in vivo, and to understand the nuances of different devices in the real tactile sense that you're going to feel it in an operating room. As a former, associate program director who really, was trying to champion education in a lot of different ways, what resources do you think that medical universities have to put that stuff on for trainees and new attendings? Doesn't exist. Who has $10,000 to get a cadaver to, train trainees about the nuances of different devices? It doesn't happen, but industry does, right? And so, and it was that's a little bit of a tangent, and I apologize, but the point that I wanted to make is that industry has really wonderful resources, and most every company has sections dedicated to the education of trainees. And I think that it is a resource that we just need to be utilizing and understanding. As long as we teach and train and understand the benefits of it and the risks, we got to be working together and just getting people trained. And then, to kind of jump back to what you were asking, I came from a place where, industry reps were, literally just, present every part of the hospital. And then I went to a different part of the country in the Northeast where it was very similar to where you trained, where reps were, you had to get a badge, you had to wear different color scrubs, a different cover, scrub cap. And, you were designated clearly that you were a rep and you had to be invited, right? And like the invitation process took time, and it was, they wanted to make it. And, and I'm looking at both and I'm trying to figure out, like, was there better? Is there worse? And I still can't make heads or tails of it, but I will say this. I think that we as physicians need to recognize the situations we need to have industry in the operating room helping us. And I think there are a couple, and I'd love your thoughts on this because I've been trying to narrow this down, right? Can I create a protocol? Can we really get this down to a science so that really at the end of the day, the only thing we're championing is the patient who's put themselves on the operating room table or happens to be there because of something bad going on. I can think of cases that I do where I know exactly the device I'm planning on using, right? I'm going in, I have my imaging, I know what I'm going to be dealing with, and I know the device that is going to help me get to the end of that case. In that situation, what is the problem with having industry around or available? I know what I'm doing. I know what I'm planning. They should be there in my mind. Is it almost a disservice to the patient if they're not there? Because I'm sort of taking that piece of knowledge out of the operating room if I'm not inviting them there. The question becomes, when you have a case and you don't know what you're doing, or you have multiple options of what you could be doing, and I've seen it done a lot of different ways. I've kind of gotten to a point where I try not to have anybody in the room in those times because, and it gets back to your cup of coffee, right? And I talk about this a little bit in the TED Talk. It's this concept of, if somebody's bought you a cup of coffee, if somebody's trained your trainees, if somebody's done these things for you, and then you're in an operating room and you encounter disease that has multiple options of how to be tackled, and one of those ways is with a product sold by the rep who just happens to be in the operating room, just by happenstance, because they asked to be, or it was just coincidence they were there for the case before. How many of us as human beings are not going to be influenced by the fact that they've sort of bought into you, you've bought into them, they have a product that fixes this problem? How many of us are big enough to be like, no, you're staring right there, you're staring me in the face, you just brought me the cup of coffee, you helped me on that case before, but I'm going to use your competitor's product because I can. That to me is where it gets tough. And I'm sure you've been in that situation, so.
Well, especially when you're young and you're new and you don't really know how it works, and you don't maybe have the confidence to be like,
precisely,
no, I'm going to use this other product because it works better in my hands. That's where it gets tricky. And that's where I can see where, my former section chief was like, you don't need to be influenced by these industry people. I get that, but I feel like you're also kind of missing out on experiences to try new things and get your hands on new things. So, it's a double-edged sword. There's a happy medium, but like how to find that happy medium.
Yeah. And again, it also comes down to your training when you're a trainee and understanding, how much education did you get about the devices that we use, right? Specific education to really tell you, like, when you're looking at a device and you're studying a device, this is how you should study it. This is how you should look at it. So that when you're in the operating room as a junior attending who's dealing with so much newness of being a new attending, that if it does come down to it and there's a product that would be better because you've studied them, you can with confidence say, I've got to use this device. Right? I mean, I've never been pressured, right? And I have really great reps and I have amazing relationships, but I do know of colleagues who have been pressured, right? I mean, it's a fact of the game. And I think I'm just looking to start the conversation that the game exists. And I think that just like in many ways, like by getting your business degree and understanding the language of business, by helping trainees understand, by giving that knowledge to the future generation of interventionalists and surgeons, we're putting the power back in the hands of the interventionalists and the surgeons.
When you're in training, the dinners are amazing, right? You can't afford a dinner like that. You're just like, whoa, what? I can order a steak and a bourbon. Like, this is incredible. But once you get out of training and, especially like you have kids, time becomes a much more important currency. And I'm sorry, sitting through a 3-hour dinner, I just can't do it anymore. I absolutely will not do it because it's not worth it. And so my advice for those trainees or even, young attendings is take advantage of the actual purely educational experiences that industry has to offer, which are the workshops, right? Go to a weekend workshop. That is well worth it. Go to something where a cadaver lab, those are well worth it. Going to a dinner and listening to a KOL talk about the latest data, I just don't, you can catch that in a 10-minute YouTube video or something online. You don't need to do that. You know what I mean?
And again, like, industry has this power to bring together, literally experts internationally and put them in one room for you as a trainee to go and pick their brain and learn from them with the different conferences they put in. And I would be considered mad if I was trying to not let my trainees go to and have those experiences, right? I mean, again, they have the resources. They have the ability to get those people into the room to allow them to teach and train the future generation. And again, after COVID, I think the walls have really broken down of how, if somebody is an expert about something in a different part of the country, their knowledge is no longer restricted to the people who they're training locally, right? Their knowledge is now up for grabs internationally, and we should be championing that. Why wouldn't we want a true expert in something to be the person who's training everybody about how to do something, right? And I think industry has really found an amazing way to have that happen, and we should be all for it. I think we just have to realize, and the backside of that is that the people that are experts that are coming to talk for industry, likely they have a disclosure slide that lists that company's name on it, right? They are likely getting paid by that company to go and teach and do those things, And so, and again, I'm not saying that it's bad. I'm just saying we should understand and we should talk about it and we should know, because knowledge is power in the sense of like understanding why a particular person is talking about a particular device from a particular company, understanding what their incentives are and what's behind their message is just important to sort of form your framework so that when you go and you're taking care of a patient, you have all the data, right? That's all that really matters. At the end of the day, right, you're taking care of a patient who's basically put their life in your hands with the procedures we're doing. And when you're making your decision, you should have all the facts.
Yeah, absolutely. And, you and I talked about this a little bit, but this is something that we struggle with at BackTable because, we are a free, it's foam, right? Free open access medical educational resource. We want to continue to keep it that way. And unfortunately, physicians can't fund it. It's just there's not enough people who want to pay for this. But I think everybody still finds it valuable and are willing to listen to advertising, not unlike going to a conference where the whole town is painted in advertising, including on your hotel key card. And we pay for that even, right? And so I kind of wanted to change that and create more on-demand stuff that people can access on the go. But the best way to fund it that we've found is partnering with industry, right? And sponsorship, that's our disclosure. You hear an ad at the beginning of every, an episode, that company was involved in, whatever episode. Maybe this one might have like a rad pad or something like that, but that doesn't mean that the person speaking is a KOL for them, but automatically. But when a doc's coming on and talking about a device, you kind of have to assume that, right?
Yeah.
And so these are the kinds of things, though, that we're trying to figure out how best to walk that line and make sure that we're providing good educational content, not creating infomercials. That being said, historically, sometimes it happens. Sometimes we get a partner and they want to put out something that's very specific on a product. But again, there is still educational information, just like a workshop. There's educational information within that experience around that product, even though it may come across as more promotional. So these are the kinds of things that we kind of are constantly struggling with, because we don't want to, we still got to keep the lights on. We don't want to paint, everything in advertising on our site.
I think it's a huge topic right now is the concept. I was just at our national vascular meeting, and I mean, the amount of industry funding, right? I mean, is insane. It's the only way the meeting happens, right? And it's the only way you're going to get docs to go, because if industry wasn't involved, the price for the docs would be astronomical. And, everybody knows, physicians make very good wages, but at the same time, cost of living has skyrocketed, right? There are so many demands on our paycheck, whether it be, if you've got kids, nannies, right? Taxes, right? You've got your societies that are asking you for money. You've got all the boards you got to keep up. And so, another thing that's asking for money from your wallet, if big business is willing to help foot the bill a little bit to make that a little bit less, I think that physicians are at a point where, that we're going to take the help when it comes. And if, and business is willing to be part of that, I think it's great. I think would I be lying to you if I told you that I went to that conference and wasn't excited about going to have the free coffee that they had with the baristas at each of the, the stands? I'd be lying. I loved it. I was so excited. I was like, great. I don't have to go buy a nice latte. They have lattes there, and I get to talk to some of my friends and talk to people about cool new products that are coming out. This is a wonderful relationship. And so I think we just have to realize that, like you said, you want to get your message out there, right? I mean, you guys at BackTable are doing something so incredible and so cool. And I've told you this in private, but I'll say it in public. Like, what you've taken BackTable from to and what you've done with it, I mean, it needs to be applauded. And you're getting the followers, the people. I mean, I told people I was doing a BackTable podcast and everyone was like, oh my God, BackTable. And this was in different specialties across different parts of the country. I mean, you guys are doing amazing, but how would that happen if you didn't partner with industry? And I don't think it cheapens your message in any way, shape, or form. You're just being honest about it, right? And I think that that's the whole goal here, is just being open and honest about what the inputs into whatever decision, thing, factor is happening. So just know the inputs, because then people get to take their information and go do what they will, right?
Right, exactly. Because how else are you going to learn about new cutting edge technology other than from the company itself? We have these media platforms. There's Endovascular Today, there's us, there's others, but the company itself is the one who is going to have the most up-to-date information, be able to put that out there. And we want to be able to partner with them. If we didn't partner with them, then it would kind of just be like, I don't know what else. We talk about other things, but it's so especially interventionalists, right? We're kind of gearheads. We want to know what's the latest and greatest. We want to know what's the coolest new stuff that's out there. They're basically like toys for us. And you have to have, industry has to be part of that conversation. And so, I appreciate the compliments. And, I want to also just though make sure that the audience doesn't feel like promotional stuff is being pushed on them, because from the physician perspective, I know how that is. And that actually brings me to my next question is what do you do about an aggressive sales or support person that's coming into your OR?
I think you just have to be honest, right? I think you just have to be open, and you have to be honest with these people, and you just have to make them realize that there's a human being that has put themselves at our mercy, and that we're going to champion everything about that needs to happen for that patient. That's it. That's the end of the story. And quite frankly, I think we as physicians have to be better about saying no if a rep is asking to be part of a case that you just don't want to have anybody be in that case, right? I don't remember a time where I saw an attending tell a rep, you can't be in my operating room. Now, maybe I wasn't part of that conversation. Maybe I wasn't there for that conversation. But, what if we just were taught how to say, no, I don't want anybody in the room right now. Thank you so much. Right? Like that was not somebody that I never saw that modeled. Right? I never saw that. And again, it's because the people I was dealing with were old enough and wise enough to sort of have anybody in the room and be able to make their own decisions. But as a junior attending, that's a pretty high bar to expect of you when you're trying to figure out so many different parts of being an attending, right? And so I think that at the end of the day, honesty and learning how to say no. And again, I think there's value in being an attending and just being in the operating room without any influence so that you can do things especially when you aren't sure. Because, as a young attending, you're getting the cases that nobody else wants to do, right? You're getting these crazy call cases where you have no idea how you're going to get yourself out of them. And, sometimes maybe it's better to have a second partner in the room, right? Have a senior partner be there if you're really curious, because I think having a senior partner really, and that was probably one of the best things about the job that I took. I had some really wonderful senior partners who helped me understand and shepherd that relationship with big business and help me kind of realize what that was. And I think, that's another really big resource. And I'll tell anybody who's getting ready to graduate that your first and foremost important thing you got to figure out with whatever job you take is who your partners are, right? And I think that they play a huge role in that. And so we have a long way to go in educating our trainees about these things. But when you're dealing with reps who, maybe you're not really sure what their motives or things are, honesty, involve a second partner, and then just learn how to say no.
Yeah. One of the challenges I've run into over the years a couple of times is where, and you may not deal with this as much in academics, but with some of these small or large hospitals, they're brand A, right? Let's say there's 3 brands for a given device. They're brand A. They're on contract with brand A. Brand A's sales rep is there every Monday, bringing lunch for everybody, but you know and like brand B, and that's your go-to device, right? So how do you get brand B on the shelf when everything's all about brand A? It's sales rep for brand A is in your face, like, hey, why are you not using my brand? That's where I've struggled in the past. It's like, no, I don't want to use that device. It doesn't work for me. It doesn't work for my patients. To me, it's a lesser device. And, trying to give it on the shelf even is challenging because admins bought in on brand A, right? So that to me is kind of where there's been some challenge in being able to say no, right? Because it's actually a bigger mountain to climb.
Yeah, it's a huge mountain to climb. And I think there's a lot of art to how we're trained as opposed to, just 100% science, right? I mean, you're learning from people who are experts in certain things. And as a junior attending, you just want to be safe, right? And at the end of the day, you want to take any unknown factors and unknown variables out of the equation when it comes to an acutely ill patient that you're taking care of. And so if you feel comfortable using a particular thing, you have to champion getting that resource in your hands because, again, your job is to just be as safe for patients. And again, I think part of having that business education has really helped me understand the vocabulary of words I need to use when I'm going to administration and explaining why it is. And, maybe I won't get something on the shelf, but I'll have trunk stock, right? I'll say, that's fine. I don't need you to have them have room on the shelf, but I need to be able to bring this rep into every operating room that I'm going to do a case like this and use their trunk stock. And we need to find a way to get them and, get the hospital to pay or, get the bill, whatever, figure out the finances of it. But I need to be safe for these patients and I need to make sure I have good outcomes and I need to make sure I'm providing quality care. And so you have to start going to your VAT committees and really understanding so that they can at least approve that hospital being used in the operating room setting. Maybe it won't be on the shelf, but that the reps can bring it in whenever you call on them. And then, then you're just really calling on those reps. But I think, again, just knowing the vocab words that are going to hit administration's ears And again, that was part of why the MBA was so important for me, is that I wanted to make sure that when I'm saying things, they're being heard, right? And you have to, I think one of the big things about the MBA education was that, and actually it was one of the things about giving this TED Talk too, was you have to tailor your message for the people that you're talking to, and you have to understand the way that they communicate, and you have to know what pushes their buttons. I don't think that this is going away anytime soon. It's going to be, it's always an uphill battle, but I think we have ammunition in our belts of how to champion things that are important to us.
That's solid advice, because otherwise they might just hear it as a personal preference, and they're like, Dr. Fritts is just being a pain. Why won't he get on board with brand A? You're right. Like, speaking their language, knowing what's important to them, aligning those values is definitely important to kind of be able to get what you need for your patients. Well, we're coming up on the hour. That kind of flew by. Anything that we're leaving out that you wanted to talk about?
No, you said something a little bit before, and it really struck a chord. It was, you said that, we should really be looking to partner with, and we're gearheads, right? We love this minimally invasive stuff. And if there's a new device or new technology, I get excited, because at the end of the day, I think our patients more and more, the number of times I tell a patient about having a maximally invasive surgical option and a minimally invasive surgical option, and the patient's like, no, I want that maximally invasive. I want to be in the hospital for a week and a half, and I really just want to feel like I got hit by a truck. So let's sign up for that. Like, I can count on one hand the number of times that a patient said that. And there were specific reasons, and I talk about that in my talk. If the outcomes are comparable and patients can do and fly in that minimally invasive setting and understand the risks involved, we all want these minimally invasive tools, not just because they're fun, but because it's what the patients want. That's what they want. And I think that what I would love to see more of is physicians partnering with industry to help develop the next generation of tools, right? I mean, you go, and don't get me wrong, all these companies have boards where doctors are involved, and, they have their chief medical officer and their scientific advisory boards. But I think that we, instead of shying away from business and industry, I think we really need to jump in, because if we can collaborate with these partners, the wave of technology that we could usher in, because we're really getting buy-in from physicians nationally about how to improve on devices and what we really need from the thousands of people that are using it on a day-to-day basis, I think it could be really exciting, and I think that, again, it just takes a willingness to understand what both parties are bringing to the table, what expectations both parties have, and who both parties answer to. As long as all of that is upfront known, I get excited about that aspect of medicine. And it's one of the reasons why I went into vascular, and I'm sure it's one of the reasons why you went into IR, is that we really do, I feel like we are at the forefront of this medical technology revolution that's happening, and it's not going anywhere. And we should continue to champion that, because I think it's meaning better outcomes for patients at the end.
Absolutely. Yeah. Just getting your, especially when you're, to me, it doesn't matter what stage of your career, get your hands on as many things as possible, play with them, test them out, even if it's not in real life. Like, that to me is actually, even better to just go to these workshops if you can, go to these cadaver labs. And then that way you can kind of feel if something's janky or not, right? Because they're still coming out with janky stuff. It's not, that's not changing either.
Right.
I think there's still cost issues for these devices, and people are trying to get away with stuff that's maybe cheaper, but we need, for better patient care, you need to know what's the best quality product and shoot for that every time. So, well, Adam, thank you so much for coming on the show. This has been awesome to talk through this. Hopefully we can get you back on for a more clinical topic too.
Yeah, absolutely. Listen, I just got to say thank you so much. This is awesome. I know I sort of cold emailed, cold messaged you. I thought, and happenstance, it just, you're doing so many cool things that I'm trying to emulate here, and the personal life stuff, and so
yeah, we got to get you guys to France.
Listen, man, my wife is just itching. She's like, you want to spend a year there? Let's do it. I'm ready. But I wanted to say thank you for, allowing me to be on and giving me a platform to kind of talk about this. I just think it's really interesting, and I really appreciate you just how engaged you are about it. And so thank you.
Absolutely. Well, thanks everybody for listening. We'll catch you guys next week. Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, direct message us at @_BackTable on Instagram, Twitter, or LinkedIn. BackTable is produced and hosted by myself, Aaron Fritts, and co-hosts
Chris Beck,
Sabine Dawn,
Michael Barraza,
and Ali Behetti.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles,
Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Ann Dang,
Manisha Naganathanahali,
and Manbir Singh Sandhu.
Administrative support provided by Jamila Kennebrew
and Judy Dela Cruz.
Thanks again for listening.